So while the session is geared towards nursing home staff, the principles could be applied to other settings as well. Please keep in mind that the session is for educational purposes only, as we are a quality innovative network, quality improvement organization, also called QIO, and we're focused on quality improvement. We're not surveyors or enforcers, so please refrain from asking questions about a specific survey you may have experienced. The session is being recorded for on-demand viewing by those unable to join us. Next slide, please, Rachel. We ask you to take yourself off mute and speak during discussion portion. So as I mentioned earlier, if you're dialing by phone, *6 will unmute and mute yourself. If your computer doesn't have a microphone, that is, if you're joining that way. This live session is approved for 1 contact hour for nurses across 6 states and nursing home administrators in Idaho, New Mexico, Oregon, Utah, and Washington. To receive your CEU certificate, you must complete and submit the evaluation pool at the end of the session. This is only available during the live event. Once the session is completed and we have your submitted evaluation, your certificate will be emailed to you within 1 week. My name is Lisa Barton. I am one of the presenters for today's session, and I am an improvement advisor on the long-term care and post-acute care team. Joining us is Nina Sanderson, who is our main presenter for today. Nina is also an improvement advisor on the same LTPAC team. Next slide. I'm going to first tell you a little bit about Nina, her background. She's been working for Comagine Health since 2022 and has an exceptional background working with long-term and post-acute care facilities. She's been a licensed social worker in Idaho for the past 24 years and has been certified by the CMS to conduct skilled nursing facility and dialysis surveys. She's worked in a nursing home for 13 years, spent 3 years as a long-term care surveyor in Idaho, 3 years as a co-supervisor of the Idaho State Long-Term Care Survey and Certification Program, and 4 years as a federal surveyor. Next slide. After today's session, we hope that you'll be able to describe the infection control training requirements and what the facility has to show to meet those requirements. We will review all the key components of a robust infection control training program, and we hope that you will be able to identify at least 3 of them. Recognize the 2 survey pathways pertinent to the infection control training requirements that will be conducted with every survey. And recognize the importance of implementing the use of a training tracker to analyze staff completion rates and target areas for quality improvement. We're going to review a staff training tracker that Comagine Health developed and facilities could use, and another tracker that corporate staff can use to track and monitor the status of staff training. I'm now going to pass this over to Nina to review what is new in the regulations and share tips to have a successful staff training tracker program.
Thanks, Lisa. Next slide, please, Rachel. The requirement at F945 says that the facility must have mandatory infection control training that includes their infection control standards, policies, and procedures. You can see that the requirement also references the Code of Federal Regulations at 483.80A2. Nothing alarming so far, right? Next slide, please. So now we go over to the CFR referenced at F945, which is part of F880, the infection control requirement. Now we begin to see what exactly the training needs to cover. The surveillance system, the reporting, standard precautions, transmission-based precautions, when to start and stop isolation, what type of isolation should be used. Oh, and while you're at it, make sure it's not too restrictive. Next slide, please. It goes on. The circumstances under which a facility must restrict work and, lest we forget, hand hygiene procedures. It's starting to feel a little bit more overwhelming, but no worries, you've got this. Next slide, please. Lisa, we have the polling question. And the question is, how confident do you feel about your facility's staff training program meeting the regulatory requirement? Very confident, somewhat confident, not very confident, not confident at all. Who wrote this stuff? How are you guys feeling so far? We'll give you just a couple moments to answer that question.
Still see some people completing it. All right.
All right. So it looks like most of you are somewhat confident. A few of you are very confident. That is wonderful. And nobody's feeling not confident at all. That is great. I'm glad to see that. So we're going to go over some of the requirements and the way things have changed. Next slide, please, Rachel. So let's break it down. Let's start by breaking. So what do we really need to know? Who counts as staff? What the key components of an infection control training program are? What do we really need to know about the new regulatory language? And how will all of this be evaluated on survey? Next slide, please. First off, who counts as staff? According to the regulation, all facility employees, both direct and non-direct care. This shouldn't pose much of a change for you since you've all been doing this at least since the beginning of COVID. The next group is contract staff. Depending on how your facility is structured, this might be your housekeepers, dietary staff, or your therapy staff. This could also include agency nursing staff, which almost everybody's using these days. Included are also outside providers like hospice, podiatry, perhaps dialysis staff if you have an in-house dialysis unit, maybe the wound clinic personnel, nurse practitioners, perhaps even your medical director. These are probably folks who've had infection control training either through their employer or from you, but there are a few new caveats which we will discuss here momentarily. Volunteers now count as staff and need to have training appropriate to their role. The remainder of the folks you'll want to make sure have some level of training are students, clergy, your beautician, and your consultants. Next slide, please. Typically, the contracts facilities have with staffing agencies, contractors, and hospice agencies specify that the agency will conduct training activities, including infection control training. However, with this regulatory update, it is the facility's responsibility to ensure the infection control training meets the regulatory requirement. Best practice would be to have either an electronic or hard copy of the curriculum on hand. If there are gaps between what the contractor provides and what is required, develop training to bridge the gap. Make sure the training is complete before a contractor works in your facility. You will also want to make sure that contractors and agency personnel are aware of any changes in your infection control practices, such as changes in masking requirements with the end of the mask mandate earlier this month, or the end of the public health emergency in May. You'll also want to have a process for contract and agency staff to access your infection control policies while they're working in the facility. This includes access to electronic policies if there are no paper copies available. If using paper copies, designate someone to regularly review them and pull outdated ones. Recognize that there is a difference between training and orientation. Even advanced practice staff, such as physicians and nurse practitioners, who may not need infection control training per se, need orientation to facility systems. This would include to whom they report concerns, the mechanism for reporting, such as a paper form or email, and if that system changes at night or on the weekend. This would also include where to access PPE and signage for transmission-based precautions. Best practice is to designate a place for all reference materials agency or contractors may need, including infection control, emergency preparedness, and abuse policies. This could be in a clearly marked cabinet at the nurse's station or a special file folder on the desktop of the workstations. If these materials are hard copies, place them in a binder and chain the binder to the cabinet. Designate someone to review those policies regularly and replace outdated materials. Next slide, please. There are some specific curriculum requirements in the new regulatory guidance. The training must have learning objectives. If you are developing a curriculum for the first time, Google action verbs for presentations. There are many sources out there to get you started and keep you focused. With practice, this will be easier than you think. Even with a training program that already has these built in, it's a good idea to develop this skill for PRN trainings. The training must have performance standards. This would be the national standard your facility uses as the basis for its infection control program, such as the CDC or APIC, or another standard your organization uses. What's important is that you know what the standard is, how to access it, and how to stay abreast of changes. The training must have evaluation criteria, or a benchmark against which the performance will be measured. The second part of this is how the performance will be measured. I recommend uninterrupted observation, which is harder than you think, but it's how surveyors find poor hand hygiene practices so easily, even when you have done a dozen trainings on it. Finally, the facility must include potential risks to residents, staff, and volunteers if procedures are not followed. While the risks may seem obvious to someone who has an infection control certification, it may not be as obvious to a CNA or a volunteer who is bringing communion to the residents without some kind of instruction. Next slide, please. So what are the key components of the infection control training? It must be based on a nationally recognized infection control standard. If you go into Appendix P under F880, which is the infection control requirement, you will see links to websites at the end of each section. Those are the standards CMS used when coming up with the guidance for infection control, if you aren't sure which standards might be acceptable. You should be training to your policies, so make sure your policies reflect the standards you are using. The policy also needs to contain facility-specific details on procedural information. Though corporate policies are a great starting point, agency and contract personnel need to know the specific procedures in your facility. For example, if a resident develops respiratory symptoms and the policy instructs that the infection preventionist will be notified, what is the process for that in your facility? Should they leave a voicemail? Should they call the infection preventionist at home on a Sunday at midnight? Agency and contract personnel need to know. The training program must adapt to changes in the standard you use. Assign someone to stay updated on the standards of practice and build redundancy into that system so that if the designated person is out sick, on vacation, or leaves their job, someone else automatically steps in. Train the backup person to the basics of how your change system works. The redundancy doesn't have to be fancy either. The best system I saw in the worst of the pandemic was a pencil and paper sheet where each department head was listed with a first and second backup for their key duties. Everyone knew who their backup was and who they were backing up. Then the backups were trained on key duties that could not be missed and had the chance to practice them every month or so. When leadership started to get hit with COVID, facility systems were able to absorb the impact with little damage. Next slide, please. So how do you go about changing the training program? The infection control training must have some formalized systems for change. These are the lessons that we all learned during COVID that can be generalized to your overall infection control training. Sometimes these changes will be based on community infection risk. We all did this with COVID, depending on the high, moderate, or low infection or community transmission rates. The same principles could be applied to flu, norovirus, or other known risks. Just like with COVID, you could have incrementally progressive measures you expect your staff to implement, and they would need to be trained with each of those changes. Build these thresholds into your policies, as well as refresher courses for key principles staff need to implement. The training program also needs to be adapted if there are changes in the national standard. This would likely mean reviewing and revising your policies. Be sure to follow your process for policy updates, which would typically involve including the administrator, medical director, director of nursing, and infection preventionist at a minimum. A good infection control training program would anticipate staff turnover and how the facility will maintain its standards even through these changes. You may need to budget for increased training time in your infection preventionist schedule and increased observation time so they can monitor for staff comprehension of the materials presented. The program must adapt to changes in your physical environment as well. This could be something as complex as a full remodel or as simple as rerouting dirty linens to accommodate fixing the floor in the laundry room. This could also be a change that results from cohorting residents if that need arises. Although hopefully we won't see those dreadful plastic and duct tape walls we all used at some point during COVID, it could mean that certain staff need to be aware that they need to take precautions to cross a certain physical barrier in your facility. Some of these components can be addressed in the morning stand-up meeting, others in the QAPI meeting, and others still may require the facility to review its facility assessment. You may be able to build some of these changes seamlessly into your policy, such as the community transmission rates of COVID-19 and how that value might impact PPE use or testing requirements, but others may need a deeper dive. For example, the end of the public health emergency in May should prompt a review of infection control policies, and the staff will need to be trained as to the changes and expectations of the facility to have a successful transition. Next slide, please. A few of the key concepts to understand when it comes to your infection control training program are: it needs to be appropriate per the standard of practice you are following and effective in that staff understand and implement the expected infection control practices consistently. It's necessary that the program be based on staff need, so it's up to the facility to determine how they will evaluate staff need. For instance, incorporate hand hygiene and PPE observations into your training program. Establish a threshold at which you will implement refresher training and ensure that all staff receive the refresher. It needs to be permanently maintained. This will be one of the hardest asks of the infection control training requirements. Build redundancies into your training program to minimize or remove interruption resulting from staff turnover in key positions, such as your director of nursing or infection preventionist. This is especially crucial in facilities where nurse managers wear many hats. You may need to coordinate with your regional or corporate leadership to meet this requirement. In the event of a leadership change that impacts your infection control training program, determine what aspects are going to be missed with the change and communicate clearly to your corporate consultants what support you need. If you work in a standalone facility or a small chain without corporate resources to draw on, have at least a primary designee for the training and a backup. Have the backup person conduct training periodically to maintain their knowledge and skills. And finally, your program needs to have a process for tracking staff participation and understanding. While many programs have built-in tracking component for facility staff, they don't have a system for tracking agency, contract, or volunteer staff, or outside providers such as hospice personnel. The tracking tool we will present momentarily will address this requirement. Next slide, please. All right, do we have any questions so far?
You're welcome to unmute yourself by pressing *6 if you dialed in, or you can unmute your microphone, or you can chat your question in. All right, I guess we can move forward. If you think of anything afterwards, you're welcome. We're going to have some other opportunities to ask questions, so you can ask them at that time as well. Let's go ahead and go to the next slide. Thank you. And so, as Nina mentioned earlier, that we have, so Comagine Health has developed a staff training tracker for facilities to use. It's designed to track the training status of current staff, including employees, contracted staff, volunteers, and students. So, Rachel, if you can stop sharing your screen, I'm going to share with you. I'm going to have some fake data in there so you can see how it works. So this is an optional tool, by the way. It's not something that you have to use. It's just available for facilities if they want to, maybe they want to improve their current tracking system. Maybe they're using a different tool that and there's some issues in that. So this might help address some of those issues. The way we set it up, the first tab here that you see is, it shows instructions. So when you want to reference this, if you do decide to use it, you can use this to reference to help guide you with the function of it, explain how it's to be used. The next tab here is called Staff IPC Training Requirements. This tab addresses the different F tags for infection that relate to infection prevention training that you can possibly acquire. And if you want additional information on these F tags, you can go click on the link that we have available here for the Appendix PP manual. The first tab here, so there's 3 different tabs that you can input data. They all serve different purposes. This first tab here is to track all of the comprehensive training. So this is the standard onboarding training and annual competencies that staff are expected to get for their training. And as you can see here, the top portion here has the different topics. So all the comprehensive training areas here. And the way it's designed is the first column, you put in the staff members' names, their employee ID, their employee type. So there's a drop down that you can choose from if you want to select what type of employee type they are, and then their hire date. And so this data just stays here. So as I mentioned earlier, this is intended for current staff. So you can use this. So basically when a surveyor comes in and if they wanted to view information on your current staff, this is a good helpful tool too. In addition to helping internally, you can also use it for surveyors to view if they wanted to take a quick look at staff, their trainings and when they last completed it. So the dates that you see here would be dates that staff members most recently complete that training. So if they've been there for a few years and they already completed their onboarding training, so now you're tracking annual compliance for them. Or maybe you have some staff who recently started and you want to track their onboarding areas that they completed. And if something doesn't apply to them because of their role, you put NA there. And we'll show in a minute why it's important to have NA. You don't want to leave it blank unless they are intended to take that training. They just haven't completed it yet. But if it doesn't apply, just be sure to put NA in there because it affects the calculation in the analysis tab that we'll look at in just a few minutes. And so this is the overall, just showing you here. This has all the areas here. There are some additional spots that we left available in case there's something maybe your facility has as a requirement for your staff, all your staff to get a certain training that's not covered one of these topics. You can add that topic here as well. You can also add additional ones if you want to, but we just we put some in here for you guys already. And so the next tab here is to track staff who complete their infection prevention training. If you want to track more detail about the infection prevention training that they are acquiring, this information will be put in here. You put in that same information as the previous tab, and then you put in the date. So what we have it set up as the date completed review of infection prevention and control plans, policies, and procedures. And so you put the date they completed that, and then when they complete the rest of the training, you put in the date that they completed the entire training. So, and then you can put the resources too. So whether it's, if you use something like Project First Line, you can put the link in here as a reference, or if it's another training, maybe something internally, you can put a little description in there about what the type of training is that they received. And you can also indicate if it's internally or an external resource as well. And then finally, we have a PRN training, because we know that throughout the year, facilities tend to give trainings depending on the need for it. So for example, facility, let's say that there was a lot of hand hygiene citations in a recent survey that occurred because a lot of staff were caught not performing proper hand hygiene. Then you decide, okay, let's do hand hygiene training on our staff. And so in this case, these staff members had completed the training, but the ones that are left blank are staff who are going to complete the training. They just haven't completed it yet. And then NA might be for somebody where maybe that because their role, it's just an example, but because their role, they didn't need to complete that specific training. And so again, that affects the calculation in our analysis tab that we're going to take a look at right now. So I'm just going to move over to there. And again, showing you here, you can manually input any of the trainings. And I did want to mention that the information that you're putting in the tracking all staff here, it actually automatically feeds into the PRN. So you actually don't have to input information in this tab here. It will reflect the same for all the staff that you have on this tab, but you do have to manually put in the topics here. You have to manually input the dates because this is a completely different type of training compared to what's in the tracking all staff, since these are PRN. So now let's go to the analysis tab here. So we have 3 tables. So these 3 tables are based off of the 3 tabs we just looked at. So the total for training all staff, this table here feeds into, we decided to get cute about it and color match them. So that way it's easier to spot out. And so you can see the tracking all staff, one reflects, so it automatically, you don't have to enter anything in here manually. It automatically just pulls everything, including the topics too. And so, you will notice that they match with what's up here in the same order as well. They feed into the cells. So you don't have to do anything to set it up here. It's already set up for you and it will feed in. And so the reason why the NAs are important is because it determines how many staff who are eligible to receive that training. So total eligible staff who completed it. So if there's NAs, it won't count them in there. So that's why the numbers vary in this example here. And total eligible staff, so again, eligible. So if they're NA, it won't determine them to be an eligible staff member. And so that way it can give you an accurate percentage rate for those who completed it, who were actually eligible to complete it. And then the staff IP, this pulls it from this tab here. So if you, just a quick summary of the type of employees and so the total staff of each of those type of employees and how many completed the training program. And then finally for the PRN tab that we showed you here, then this pulls it from there. So as you can see, this data will populate based on if you put in other topics in here. So let's put a test, for example. I'm just going to put a random one. So as you can see here, I put test, and then it will feed it into here. So you don't have to put anything in this side manually as well. You put it on only the actual raw data tracking form, and then it will pull it from here. The numbers will also populate based on what you put in. Again, if you put NA, it will remove them from the calculation here. So it will give you an accurate completion rate as well. So that's the staff training tracker. In addition to that, I wanted to show you another form. I'm going to stop sharing really quick and show you the other form I want to display for you. So we developed a form called the process guide for tracking. Oh, hold on 1 second, the little thing's in my way here. For tracking staff trainings. And so this guide was intended to help facilities, regardless of whether you're using the staff training tracker that we just reviewed. You don't have to use that to use this as a reference. This is actually, it was developed to help facilities with improving their tracking process. And so it could be any facility that can use this. There's some great tips in here that can help you. We do have some tips as well, though, below that do reference the tracker. But again, you don't have to use the tracker. If you don't want to, you can just look at the tips above up here. This is kind of the tips down here, though, for the tracker, just kind of help facilities get a better understanding of what the details are for like the PRN trainings, a little more detail. Also the NA that we just talked about, why it's important to have NA in there instead of just leaving something blank if it's not applicable for that role. And so this is also a great tool, and the links to both of those are posted in chat. And finally, I'm going to share with you the corporate tracker now. The corporate tracker was developed because, for corporates, not all corporates have a system such as Relias or, something of that sort that they can track their facilities staff trainings. And so this is a great tool that was developed to help those corporates. So your corporate can download this version, the link's posted in chat. And so again, we have instructions here. So for them to reference, for corporate staff to reference. And so I'm going to show you actually the analysis tab that I just showed you for that table in the previous form. So that data will get populated from the total for tracking all staff education table that we looked at. That was the first table on the left. And so that data you can copy. Well, you can transfer it many ways. You can either copy and paste it if the corporate person has access to the staff training tracker, maybe a shared folder that both the facility and the corporate person can access. They can always copy and paste that data into the worksheet here, or maybe the corporate facility can send it to them in an email, the content here, and they can copy and paste it from the body of the email into the tracker. But that's where the data comes from, though. And so, yeah, this is a great reference. It explains all how each tab is used, the meanings of the definitions of certain fields. And so this is the analysis tab that again, you don't have to manually input anything in here. This will actually pull data from the tabs for each facility. So it's set up where the corporate can input each facility that is in their corporate, their names in here. They would input their facility name. They will input the CCN in here. And again, this is fake data, so we just did it to show you how it will look. But so they would paste the information that was in the table from the staff training tracker. They would paste it in that month. So, okay, in January, this is how the total staff that worked in that month, and we want to see what their status was. So, and each comprehensive training. And the reason why we focus on comprehensive, because that's the requirement. And so this is the minimum requirement to track this information here. So, and again, we had some TB spots. So if a facility is tracking additional topics as an annual requirement for their facility, then they can go ahead and input those topics there too. Again, they can add more if they wanted to. And so they would input the data in here after they get it from the facility, whether it's through the shared folder that they can just copy and paste into here, or if it's through an email, however it's sent to them, they get it and they paste it in here. And then that data will feed into the analysis tab here and it will populate. So you will see this will populate here, the name, facility name, and the CCN, and then the total completed training. So this is per each individual staff member. That's why the numbers are pretty high in this, but then the overall completion rate is what they'll corporate members will want to focus on is the rate for that facility in January, and then comparing it to February, and so on and so forth. And it's for each facility, as you can see, there's a line for each facility. That's really about it. It's pretty, once you get started using it, these are very easy tools to use. We try to make them as user-friendly as possible. So hopefully, if there's something you're interested in, you can click on the links and let us know. You're welcome to reach out to us if you have any questions or want to get some one-on-one training to get a little more adjusted to the tracking sheet. Okay, so let's see here. That's about it for my part. So I'm going to go ahead and pass this. Let's see here. Rachel, can you share the slides, please? Thank you. You can go ahead and go to the next slide. Next two slides, probably. These are just some notes for you. If you download the slides here, we just had some placeholders for them, so that way as a reference. So are there any questions so far? You're welcome to unmute yourself or post it in chat. I don't see any so far. Okay. All right. Well, let's go ahead and move on. I'm going to pass this over back to Nina. Thank you.
Hi again. Thank you, Rachel. We are curious if you're familiar with the survey pathways and if you're using them to get prepared for survey or in other creative ways. Please take yourself off mute or post your response in chat.
Great. Seeing some yeses here.
Seeing some yeses. Somewhat use them, not sure. For those of you who are using them, the pathways did change with the most recent regulatory update that came out in October. So if you have old ones, get rid of them and download the file again. And we will show you at the end of this presentation how to find those pathways. Okay, great. Well, we're going to talk about them and then we'll show you how to find them. Survey pathways are the mechanism by which surveys will evaluate your compliance with regulatory requirements. If you're not already using them, we'll show you how to access them later in this presentation. There are pathways for concerns brought forward through individual resident reviews and pathways for routine tasks that look at facility systems in key areas on all surveys. Using the long-term care survey pathways, let's take a closer look at how your training program will be evaluated on survey. The pathways that pertain to infection control training are the infection control pathway and the staffing pathway. These are two of the routine tasks that are part of every recertification survey, regardless of any identified concerns or lack thereof. The pathways and the links we will provide are the same pathways that a surveyor sees in the long-term care survey software. Survey is very process-driven. The survey team is going to evaluate regulatory compliance by using the information specified in the pathways, using observation, interview, and record review. The first step of evaluating your training program is via the infection control task. Surveyors will watch staff as they implement standard precautions while caring for and interacting with residents throughout the day. They will observe whether residents are afforded the opportunity, queuing, and assistance for hand hygiene as well, especially before and after meals, toileting, and activities. They will watch staff obtain, don, doff, clean, and dispose of their PPE. They will watch as clean and soiled linens are transported to and from resident rooms. Residents and their families will be interviewed as to staff awareness and implementation of infection control practices. Staff will be interviewed about their infection control training, their awareness of what to report as concerns, and how and when to report concerns. Any identified areas of concern will trigger a deeper dive through the staffing task. Next slide, please. If the survey team identifies concerns in infection control through their observations, interviews, and record reviews, they will address these concerns not only in the specific instance they are investigating, but also in the completion of the sufficient and competent nurse staffing review. While the task itself is regarding nursing staff, it is through this framework that surveys will investigate any infection control training concerns they have. Here, they will conduct further interviews with those working directly with residents about the training they receive, how competencies are evaluated, and how confident they feel with their skills in relation to their training. They will also want to know how staff let facility leadership know if they don't feel they have the knowledge they need to prevent the spread of infection. Surveyors will ask your facility staff how confident they feel about the training and skill sets of agency personnel working with the residents as well. They may review grievances, and if they conduct a resident group interview, they may ask the group for feedback. After these interviews and considering any concerns they have through the infection control task, they will conduct leadership interviews and decide whether they need to review training records and whose training records they need to review. The competent staffing review process may be mirrored as surveyors evaluate other programs as well, such as abuse prevention and dementia care. It should be noted that the pathways are related to the federal regulations in Appendix P. There may be more stringent state licensing requirements in each of your individual states, but we're not going to go into that because we have a lot of states represented here and my brain only holds so much information. So with that, I'm going to turn it back over to Lisa.
Thank you. Next slide, Rachel. So as Nina mentioned earlier, these pathways, especially for those of you who have never accessed the pathways before, we're going to show you really quick on how to do that. And so the link that Shannon just posted in chat, you will go to that link. That's to the nursing home webpage on the CMS And so you will, once you get to that link, you're going to scroll down to the bottom to the section called Downloads. And in that section, you're going to find a link. It says Survey Resources. Right now, it's currently dated to 17/23, as that was the most recent update. That date will probably change down the line when they make additional updates, but you basically want to focus on Survey Resources. That's the main thing. So once you click on that, go ahead and next slide, please. So it's a zip file that what's going to happen is when you click on that, you're going to get a zip file pop up, and then the window. Once you open up that zip file folder, you're going to see something that looks like this. There's a lot of different documents, and there's some folders in here. The second to the top folder, it's called LTC Survey Pathways. You're going to click on that folder, and then it will take you to these documents here. So the two pathways that Nina was just reviewing. So the infection prevention one is right here on the top. There's a Word document and there's a PDF file. And so you go there, and then to access the other one that Nina was reviewing is called Sufficient and Competent Staff. Sorry, it's a little small for me to read. So there's a Word document and PDF as well that you can download both of those. And as you can see, there's a lot of other great resources in here too, but since those are the two main that we're highlighting today, just want to show you those two. Next slide, please. Are there any questions so far? Feel free to unmute or post in chat. So after going over that, hopefully those of you who have never accessed it before, hopefully that was helpful in helping you find that. And so we're going to go to the next slide. And we're going to review some key points to remember. And so the key points from today's session are the infection control training requirements they've brought in to include all individuals who contribute services to your residents, even if those individuals are not on your payroll. All staff, even those who don't provide direct care to residents, need to have infection prevention training appropriate to their role. A robust infection control training program is based on a recognized standard of practice, has learning objectives, performance standards, evaluation criteria, and includes discussion of potential risks of not following procedures, and has a formalized system for change. Your training program will be evaluated on survey by the infection prevention, control, and immunization pathway, and the sufficient and competent nurse staffing pathway. It's important to have a tracking system that gives you at a glance information on your training program, so you can quickly respond to gaps in your training and set your staff and residents up for success. If you're struggling with this, you can reach out to us and we will see how we can help direct you to the appropriate resources. Next slide, please. Your action item for today is to review your training program to make sure it meets all of the criteria we covered today, and to review your tracking system to ensure that it includes all of the individuals are now required to have the training. If your tracking system doesn't include all the individuals, download the staff training tracker that we showed you a little bit ago and take it to your QAPI committee for consideration. Next slide, please. We want to do a quick evaluation. There's 6 questions in there. If you can please just answer that. And remember, this is the only opportunity that if you want to get CEUs, this is the only opportunity where you can get those CEUs. You have to complete this evaluation. Remember, scroll down because there are 6 questions in here. And while you're doing that, I'm just going to go over a few additional slides for informational purposes. Next slide, please. All right, so Comagine Health hosts monthly sessions. We have a monthly vaccination station. It's the second Tuesday of the month. And this is where we review guidelines and updates for adult vaccinations. We talk about barriers and successes. And so other facilities can share what they've, any barriers they had and how they whether it's a current barrier or if they were able to conquer that barrier and what the outcome was. So this is a learning experience for facilities to learn from each other, but we also share some tips and resources as well. We have NHSN open office hours. So, if you have any staff members or if maybe you yourself are new to NHSN, or you might have some questions when it comes to NHSN, anywhere from getting set up with your SAMS registration to NHSN reporting for the pathway data reporting option or vaccination reporting for residents and staff, we can review that during that session. And I do I do tend to review the vaccination reporting anyways, because there's usually somebody who's not familiar who joins that. So I do review that. So if you want to get like a recap or maybe a refresher or just learn about vaccination reporting, we can go over that at that time as well. Driving Clinical Excellence. This is the first Tuesday of the month, and the series combines interactive education, small group consultation, peer sharing, and micro learning opportunities on effective clinical and change concepts. We're finishing up series 4B coming up soon, and so there's a registration link for all 3 of these sessions, including that Driving Clinical Excellence series. So if you're interested in attending those, you only have to register once, and then it's a reoccurring series that stays on your calendar and throughout the whole series. Next slide, please. And here's the contact information for the 6 days we work with. We work with, as I mentioned earlier, Idaho, Nevada, New Mexico, Oregon, Utah, and Washington. And so if you can contact any one of these people, really. We all work together closely. So if you happen to contact any one of us, we will direct it to the appropriate person and send you the appropriate resources you need, or provide whatever support you're asking, the support you're asking for. We can work with you on that. So next slide, please. And here's the resources and reference page. So this is the links that we shared in chat. This is the page that has them all together. Next slide, please. All right. So any last minute questions? We have a little bit of time. We have about 12 minutes. So if you have any questions, would like us to maybe talk about something that maybe you want to get some clarification on, something we addressed, you're welcome to ask us. Was there anything, I'm just curious, is there anything in particular that we reviewed today that you thought that you learned and you're going to consider, or you will start implementing in your building based on what we discussed today?
This is Barbara Gamble. I'm just going to say I like the tracking sheet because it'll give me a more precise method of keeping track of my teaching for infection control. And I do have a question about that. Do I need to keep the tests that I give? For example, like when we had sepsis month a couple of months back, I had a module for all the aides that they did, and if they got their test and they passed with 80%, they got a candy bar or their choice of candy. Do I need to keep those tests, or just that it was completed and that they passed?
Nina, do you want to answer that question?
This, from a survey perspective, keep that it was completed, keep that it was passed, and unless there are concerns identified through observations on survey or through reviewing your infection control program, you should be fine.
Okay. And I have an additional question for you, Nina. When we had survey last time, one of the questions that the surveyors asked me in my interview was, what specific teaching did I do? And I said, well, staff development was pretty much doing the infection control. And since that survey, I have since done more things for our staff that aren't students. So, and I hope I'm addressing that need. I want to be sure when survey comes in next time and they ask me, well, what have you done specifically in terms of infection control teaching, that I'm addressing that need, because it was understood that staff development was going to do this, but I'm seeing where as infection control, I need to be doing it.
Yeah, unless your staff development person has their infection preventionist credential, which I'm presuming, Barbara, that you have that for your facility, I very much can see where the person who is teaching the skill has to have the expertise to teach it. So it's not uncommon to see more than one person in a facility who are responsible for education. I think your safest bet, not only to have you do the training, but perhaps your infection or your staff development nurse could take the CDC train long-term care infection preventionist training and get that certificate. It's free. It takes about 25 hours. But then that person would also have the expertise to conduct that training, as long as they were following whatever training program you have with those learning objectives and performance standards and evaluation and the consequences if those steps aren't followed.
The person who was doing our staff development previously was staff development infection prevention. So she was the infection preventionist and retired. And I took over the infection preventionist portion of it. And a nurse who was here, who has since left as of the 31st of March, who was doing the staff development. So, I mean, I can see where would be some confusion. I just don't want to overlap training, but if she's dealing with just the CNA students, because that's all she's doing.
Mm-hmm.
And then outside training, like we recently had a GIP hospice training. She made arrangements for that. I guess I would see my role as being sure that the permanent staff that aren't, training to be CNAs are up to date with all of their infection control teaching.
Yes, and you're probably not as far off the mark on that as you think you are, because everyone had to have that training during COVID. So a lot of facilities have just broadened that to include everybody else on their staff. And again, it's pertinent to the role. So your social worker, I'm a social worker, so I say this from a social worker's perspective. Your social worker doesn't know how to maintain infection control practices during peri-care, right? But they do need to know hand hygiene, cough etiquette, what PPE to use when going in and out of isolation rooms, how to don, how to doff, how to dispose, et cetera, et cetera.
Okay, thanks.
Nina, we have a question here. It says, what is the time frame for getting new agency or students up to date with infection education?
Isn't that the sticky wicket? The reg doesn't come right out and say, however, this would be my cautionary tale. If you have somebody out there interacting with your residents and you haven't provided them the training and they do something incorrectly or inefficiently or whatever the word is, then you're setting your residents up for that potential to become infected or to have cross-contamination. I would strongly recommend having those people do infection prevention and abuse training minimally before they ever walk out onto the floor.
Thank you, Nina. I do see some questions here asking about the slides and links. So we're actually going to send out a follow-up to everybody who's attended with the slides, and the links will be in there so you can get a copy of that. And we are recording this too, so we will have the recording available in a few weeks. And so we're going to promote that as well. Once that's made available, we'll put it in our newsletter. Any other questions? We have about 5 minutes left. Well, thank you for those of you who joined us today. And if you have any questions, oh, go ahead.
There's a question.
Oh, I missed it.
It says, what are passer staff that come to visit residents or take them on outings? Do they need the education? It's PASRR.
Yeah. God bless you for coming from a state that actually sends PASSR staff out in person. That's not universal. I would say, yeah, if this is a person who's coming in, going to be interacting with even just one of your residents, but again, they would need education that's commensurate to their role. So again, they probably don't need to know about peri-care unless they're going to be doing that with your resident, but cough etiquette, hand hygiene, PPE use, how to report a concern, maybe some symptoms that they're having that would indicate that they're not to come into your building today. If they have a sniffle or a cough or whatever. I would say that person, if I would say that person would have to have at least some education, yeah.
We can stay on. We have about 4 minutes left. We can stay on. For those of you, thank you for joining us today. But like I said, if you have any other questions, you can stay on here, and we're going to stay on until the next 3 minutes now. Thank you.
I will say that in prepping for this, I went out and I found, who was it? I want to say it was John Hopkins or one of those places had put together a little YouTube video for volunteers that, maybe 10 minutes, and they just went through what the volunteer was going to need to know, just the high points. And that I found that helpful. Don't be afraid to use the internet to find resources.
There's somebody that asks if signage counts as education or training.
No.
What about for less frequent in facility volunteers or students? Could this sometimes be introduced in written form with something for them to sign saying it was received?
So again, if you go back to the criteria for learning objectives, evaluation criteria, et cetera, you would have to make sure you were meeting all of those requirements with something like that. Typically, a read and sign isn't going to be sufficient if there's been a breach and someone's asking you about it. Or, how would it look if you brought it to your QAPI committee? What are the kinds of things that you would want to know if there was infection in your building?
There's a question here. It says we have pre-requirements and packets for our agency staff, also policy reference binder. Is there a list of topics that must be covered so we can double check if that's sufficient?
Yes, that'll be in F945, which is on the link slide that we're sending out in Appendix P. And then just make sure that you have a mechanism to evaluate comprehension and performance with anybody who's providing service to your residents. That's the hard part. That really is the hard part, especially with agency and contract. We actually ran a question by the state agencies that we could get a hold of in terms of, I'm thinking of the kids who are coming in for Christmas singing Christmas carols, or at Halloween time trick-or-treating or anything like that, little 4 and 5-year-olds from the preschool with their sniffles and their mittens hanging out the end of their coat. And we didn't get real cohesive answers across the board. That's one of those things that'll probably, work itself out in time. But I was even envisioning having the infection preventionists meet the kids in the lobby, talk about keeping your hands to yourself, using, sneezing in your sleeve, that kind of thing. Just something that's commiserate to the person's role and age appropriate when it comes to preschoolers.
Okay, we're at the top of the hour now. So thank you all so much for joining us. If you have any additional questions, you're welcome to email us with those questions.